This is KAAKAKI, the African Voice.
Well, we told you earlier that today is World Cancer Day, and from available statistics, about 80,000 Nigerians die from cancer yearly.
Definitely, and going by the statistics, more action is definitely needed, especially in the area of sensitization, orientation, and maybe avenues for people to get cured, especially at the rural area. Yes, and going by the theme, not beyond us as well, I think there's more action needed by everybody together.
Yes, indeed, not beyond us. That's to give hope that cancer can indeed be defeated, at least prevented. Well, we'll be talking to youth group here who have been doing their own bit, taking an initiative called the Pink Project to ensure that they contribute to this fight against cancer. And we have them here in the studio with us. Dr. Agma Esther Cegbeyi. She is the head Vaccination and Education Project Pink Blue. You're welcome to the show.
It's good to have you.
And of course, joining him is Runcie, Chidebe, Executive Director of Project Pink Blue.
You're welcome.
So what's Pink Blue all about? I see you wearing pink and blue on the sleeves. So what's it all about?
Yeah, Project Pink Blue, it's a youth organization that work against preventing cancer. We run free screening programs for cancers in rural areas and also in urban areas. We are involved in different projects. There are different things we've done so far. Last year, we ran screening programs for women in Kabusa, and we also did organized one at Old Parade Ground and one in Kuje. And on Saturday, we'll also be having a walk, race, and run against and cycling against cancer.
I think you've been doing screening. How key is early screening, early detection to surviving cancer?
Early screening is very, very paramount, because when a woman gets screened, or anybody or a man gets screened against cancer, there's chances of early detection, therefore preventing against late stages that can occur in cancer. So early detection, early treatment prevents against late stages of cancer that can be detrimental to the health of an individual.
All right, Chidebe, the cancer statistics is still very high. And you have about 10 Nigerians dying every hour. That's pretty alarming. Now, what is the problem? What seems to be the problem, even with all the sensitization going on?
Okay, you see, one major key challenge in cancer awareness is some cultural factors. You understand, you see where people really assume that cancer is possibly something that is an attack, or something that is from maybe one native doctor, or something that is so juju, or something of that nature. And this is, I'm telling you, there's something that is real. When we go to communities, we try to talk to people about breast cancer. People don't just even want to hear the word cancer, because to them it's already crossed that when you have cancer, it's dead. And that's the key to what the world, the Union for International Cancer Control and other organizations all over the world are trying to fight, mostly in Africa and in Nigeria, to see how we can reducing the incidence of cancer means reducing how the number of people who actually have late diagnosis of cancer, and possibly reducing cancer at a very minimum level. What it means is that more awareness is needed. People need to get right information, not what Mama Nkechi said, or what Ginika said, or what Zainab actually said, or something of that nature. So when people get accurate information,
they would also be able to be informed. But what is the Pink Blue doing about the burden of stigma? Because you can't still take away that from cancer. How do you look at that?
Brilliant. In our project, we have a project today. We have the benefit event, which is happening at Sheraton today by 10 a.m. We're bringing cancer survivors, real people who had battled with cancer and they survived. We're bringing them to actually come and share their experience, to tell the world that Nigerians have actually survived cancer. And not just that they survived cancer, they were also treated by Nigerian doctors. So you see, the key thing is we have to start talking more about it. We have to trigger more conversations. We have to start showing these people love. Help them, make them understand that, hey, you're battling cancer, but you are going to make it. most people who actually at some point really die even when it was detected very early, it's because of their own psychological mindset. They really felt like, I have this disease, I think there's nothing I could do. I mean, I'll definitely die. So, we are
does not come out from the stories of people who have the best access to medical care, but yet they still die. So somebody right here who doesn't really have access, doesn't have the material or financial resources, just sign off.
You see, cancer, it's some people will tell you that cancer is slightly a confusing disease. Even up to now, there are some cancers that we don't even know what actually causes that particular cancer. However, like cervical cancer is 100% preventable, but people don't even know there is a vaccine that even the Federal Ministry of Health and other countries all over the world has actually endorsed. So you see that because it's a complicated design, it needs to be detected early. You see situations whereby someone could have a breast cancer, and if timely care is not given, the cancer could spread from the breast to the lungs, from the lungs to otherwise. I mean, part of the documentary we are going to launch today at Sheraton Hotel, we actually showed a very dynamic story of a woman who had cancer of the breast before she knew it had actually moved to the liver and lungs. And even if you actually travel to India or anywhere, at some point, it's usually difficult that the person survives it.
All right, Esther, now I know that countries like Kyrgyzstan, Nepal and Islamabad and even India has made conscious efforts in doing something called the Community Health Watch, where, especially at the counties, at the rural areas, you have neighbor-to-neighbor information, sensitization, woman-to-woman groupings, and etc., etc. But there seems to be a backtrack, right? Especially when it comes to World Cancer Day, you see groups come out, start to do sensitization. What about beyond the days that cancer takes aside to celebrate their days? Is there any continuity in what you're doing?
Yes. Beyond today, that's why we said we've organized programs, not just today. We've had programs last year before World Cancer Day today. So we need to educate these rural women. We go into rural communities, educate, we share materials, pamphlets, telling them about cancer. We make them realize that you can examine yourself, like self-breast examination. You can do that in your own private room, and you check for lumps or change in breast tissue or nipple discharge. You can do that yourself, and if you find any abnormality, you report to a nearby hospital. We educate women on screening. Go to the nearest place for cervical cancer screening. There are several screenings that have been done. Most people are scared that it's expensive or it's painful, but these factors, when you go there, there are free screening programs for cancers. Like cervical cancer, the most implicating virus is human papilloma virus. So we run a visual acetic acid test, which is a screening examination to check if there are abnormal cells, precancerous cells. Also, there are pap smears that can be done, and these are not painful procedures. So we educate them on all this. There are other tests like iodine Schiller's test. So all these things can be done. So we educate these women about it, and we encourage them in their various groups, community groups like Women Fellowship, Men Fellowship, or other youth organization within and around. You can talk about these things, and then you come up with ideas on how to mobilize people to get to a place where they can get such services. So beyond this day, we continue the information and education.
What's the scope of your screening coverage? What's the scope? Is it just within the FCT Abuja or the North Central?
No, not just within Abuja. Yeah, but I mean, we've also done some awareness programs outside Abuja, so it's not like strictly within Abuja.
Now, what are the statistics you've been able to get of incidences of cancer within the area, let's say Abuja, which you have concentrated solely?
You see, the incidence of cancer is not really reported as, other illnesses. That's something very key. A lot of people have to really understand.
Yeah, because one of the major problems we have in this country is statistics and data.
Yeah, but I have a good news for you.
Yeah.
I mean, Globacom and some international organizations have started beyond hospital-based collection of data in Nigeria. And we are hopeful that, for instance, we are all saying, an estimated 80,000 people die of cancer every year. It's an estimate. It's not something that, we have to want to go beyond that, and it's happening. Just adding to that, some of these things has to do with policy. So it's a policy issue, and we are optimistic that with what we're doing and with what AIT is doing and other organizations, we can press further to see the policymakers to understand that this is a key issue. Stop treating cancer as malaria. You understand? There is a need for everyone to get involved. The president, the ministers, everyone, the journalists, the musicians, everyone need to get involved.
I don't think treating cancer like malaria would even be good, because malaria is having so much attention and so much funding right now. And that kind of funding and attention goes to the cancer awareness thing.
What I mean beyond funding, funding, you're right. But what I mean is that people should understand that this is an expensive disease per se, in quotes. Okay. That's what I mean. So it means that why I say they should be treated as malaria, it means that if I have cancer, I need more support beyond just For instance, she was very right when she talked about community watch. Cancer screening in Nigeria is just sporadic on an individual basis. It's just you and your family alone. And that's why this year's World Cancer Day is actually focused on not beyond us, that people should start looking at psychological effects of not just I as someone battling with cancer, but my family.
All right, let's look at funding again. Let me come to Esther. I know you're wearing pink now. Across the world, a lot of people seem to adapt or attach the color pink to cancer. I know in England it was Wear Me Pink in 2014. Certain countries like US said Pink Friday, Sports Pink Friday, pink council, pink this. Okay, and somebody would think, does that connote feminism in any way? But let's leave that away aside for today. But let's look at fundraising. I know that fund is a big problem and a big challenge, and I think that if you go to a lot of hospitals in Nigeria, you would at least find one cancer patient who needs funding. You can actually see some of them on the television when they're looking or soliciting for help. How do you go about your fundraising? Do you do fundraising projects in it, to support victims who are in different parts of the country or in different hospitals, even though I know that they might not be able to pay back in a certain way? Is there any platform to raise funds for such people?
Like this event we're having, we're trying to raise funds for cancer patients. Okay. So we're organizing raffle draws and we're organizing walk and all that. This is the first time we're actually organizing fundraising program. Absolutely. So we actually need support from other organizations to help out, because by saving a life, you've saved a whole lot. You're not only saving one person, you're saving the whole family and even the entire nation or the whole world. So it's good for people to come out to support this noble cause, and that's what we're doing.
Project Pink Blue, before I go, started from the NYSC camp, and then into a full-blown association and organization. Now, how did this change come about? What gave you the flair? How did you get involved? Esther, you.
Project Pink Blue started as a community development service program, and after that, we saw the need to continue with this cause because we were encouraged with number of women that turned up during the program when we started initially, and we had other requests. People were requesting we should come do this program here, come do this program there, like the one in Kuje. So we decided, okay, let's continue with this. In so doing, we're affecting the lives of other people, and that's how we continue as a team. And we've been doing that, and today we're also having a program, and on Saturday also we'll be having another.
Okay, well, you guys are still a team of young Nigerians with this wonderful initiative. What major challenge do you see out there on the field as you continue with your advocacy against cancer?
Trust. Trust is the key word. I'm emotional about it because a lot of people don't trust. So you see, when you're running a non-profit, people just think you are just out there to just cheat them or to
You
make
blame
money
them
out of them.
considering antecedents, that have happened in the past?
Yes, yes.
Do you really blame Nigerians for that?
No, not at all. And that's why we never organize any fundraising at all. But we have to do this because it's so unfortunate because the young guy who was actually the person who motivated us to plan this fundraising for Saturday by 7 a.m. to do a walk at Sheraton actually died just last week. You understand? So people find it so difficult to trust you when you're doing a non-profit. Yeah, and that's why we said when we decided to continue, we said we're not going to do any fundraising. Let's just run projects so people can trust us. People can see what we're doing. Let's show people we're supporting. And right now I think we are getting the trust because we've got lots of support and we are calling on celebrities. We're calling celebrities.
And brand ambassadors.
We're calling musicians. There are some of them who will call and they keep calling money, and then you'll be wondering, we're trying to raise funds on Saturday for a walk at Sheraton Hotel, 7 a.m. to support people who are battling with disease, and someone is also asking you to, how much are you going to give?
Nigerians are hearing you right now, so I'm sure that trust the pink blue. It is for a worthy cause. It's World Cancer Day. Do what you can to go out there and get screened, whether you're male or female.
Also want to tell us where the screening centers, where will screening be available for people who may want to come?
Yeah, the screening is available actually at Sheraton Hotel.
Today?
Free of charge, not today, on Saturday. Yes, it's happening. It's a walk, a race, and cycling. We're getting about 50 Wheelers Association cycling in Abuja against cancer. Then people will also be running, and they will have a walk. People who can run, the idea is if you can cycle, you run. If you can't run, you walk. So whatever you're doing, just walk against cancer.
Maybe you should make a Chidebe ambassador. He's very good at that.
And it will be happening at Sheraton Hotel, 7 a.m. on Saturday, that's the 7th. And we expect everyone to really, you're in Abuja, get your canvas, get your t-shirt, just come and let's all...
Maybe look for some pink to wear.
Because prostate cancer as well. We're also getting an organization who actually provide free prostate cancer screening and also cervical cancer screening.
Thank you so much. Thank you so much for coming. I think Chidebe, we should take them up on the cycling and maybe we'll some other race.
Yeah, we'll do that.
Well, let's say thank you. We want to say thank you to you, Dr. Agma Esther Cegbeyi, Head Vaccination and Education Project Pink Blue, and Runcie CW Chidebe Executive Project Director Project Pink Blue. Thank you for coming and all the best. And we trust you.
Thank you so much.
Thank you.
Yes, indeed. Not beyond us. That's the word for today as we mark the World Cancer Day. Thank you so much for investing your time with us. So we'll see you again tomorrow. Have a wonderful day.
Goodbye.